Hello, hello. This is Dr. Ashley Parks sharing a little bit about program planning, specifically for public health and a little bit for public admin. On the agenda today, I am going to talk through a couple different planning models. And then at the end, we're going to do a focused little review of the fishbone diagram process, the map planning process, and of course, we'll discuss one of the main program planning models used in public health, which is pre-seed proceed. So in order to get started, we have to know that intentionality, deliberate intentional efforts are required for public health programs to be successful and for programs as health services administrators to be successful. So planning models represent these visual views, visual representations of what we're trying to do when we engage a community around solving a problem. There's a lot of different models and a lot of different names and a lot of different acronyms, but the idea of this focused effort around examining a public health issue, coming up with a solution or a program to address it, planning out a full work plan of how we'll do it, that is public health program planning. Now, there is a generalized model, a general approach that most folks know about and use to some extent. And it's 5 steps, 5 simple steps. And we can call them different things. We can break them down further into different steps, but these are the 5 broad steps for program planning. And this is a great graphic that reviews those, but we really start out with assessing needs and capacity. So we do a community health needs assessment or community health status assessment and look at the community needs. And then we reflect inward and look at our organization and our community and the capacity to address it. What resources do we have to address that need? Once we know the need and our capacity, what we can do about the need, we start to plan. We develop some goals and objectives, what we want to accomplish. We design an intervention, the actual thing we're doing. We implement that and we evaluate it. We determine whether or not it worked. And so that's really the generalized model, starting with, again, assessing our needs, right, in our communities, local needs. And I recorded a whole other lecture on that, so I won't go into that too in depth, but the idea of doing the community health needs assessment. Then once we have all that data, we set goals. And normally goals are these broad, open, broad sweeping statements of, we want to reduce diabetes in our community, or we want to improve diabetes management. And then the objectives come underneath the goals and are far more specific. We want to reduce, let's say, vaccinations. We want to increase the rate of flu vaccinations in our community by 10% by the end of the fiscal year, by the end of the calendar year, by October 1st, 2027, whatever it might be. Those are objectives that are specific and measurable, and they give the goals a little more teeth, a little more measurability. So once we have our objectives, we start to design the intervention. We develop what we're actually going to do to meet those objectives and goals, and we implement it. And then we spend quite a bit of time, we leave a portion of time at the end of every program, every grant cycle, to really evaluate how it worked. And this is really a useful general framework that we use when we're writing grants for funding for public health programming, is understanding what we did and then evaluating that work. There's a lot of different models that we use. The most prominent that I've used quite a bit is something called pre-seed proceed. And we say it's the most enduring model in health promotion. Now, I've spent most of my career actually as a health services administrator in hospitals and health plans. We do the same work. We don't always call it the same thing. So a lot of different names and labels, but the idea of starting out with identifying the environment and the constructs, the realities, the variables that we're dealing with in the first part of the model, and then coming in and looking at what we can do about it, the policies, the organizational realities, the capacity, and how we can move forward is really important. So this is an image of the pre-seed proceed. And you can see we start out in this far top right-hand corner. We start out with social assessment. We look at the environment. We perform an epidemiological assessment in many cases, looking at disease incidence. Then we move into looking at educational and ecological factors, the world around us, a little bit further, right? And if you notice the graphic in the middle, we're looking at genetics and behavior and environment, all these different factors to try to see if they help or hinder our ability to move forward. So is it a predisposing factor? Is it something that predisposes or increases our likelihood of something? For example, right? We might say that limited access to healthy food in an area is a predisposing factor. It increases the likelihood of diabetes. Okay, what's a reinforcing factor? What reinforces positive behavior? What reinforces negative behavior? And what enables us to change? So we look at all of those types of factors and we develop a program or policy. We develop an idea to intervene, and then we work through the whole bottom is evaluating it. And so I'm going to walk through a few slides more specifically with each of these stages. Okay, so the first three phases are our assessments, right? So we're going to look at the social world around us, understand social determinants of health, who has access to what services, right? And do a little bit of a situational analysis. This is part of the community health needs assessment. Then we do an epidemiological assessment. So we look at incidence of disease rates, we look at secondary and sometimes collect primary data to help us understand the condition that's affecting people from also a very clinical perspective sometimes. And then we look at the world around us and additional factors. And the educational and ecological assessment often gets confused with the social assessment, but what we're doing here in phase 3 is figuring out those factors. What predisposes us? It's a factor that's needed before the behavior, such as having only access to fast food in the small rural town that you live in with very few veggies and healthy options and resources. That's a predisposing factor that leads to unhealthy eating, could lead to diabetes. Then we have enabling. What factors are needed to engage in a behavior? What helps us do something? And quite often I normally frame enabling factors as what would help someone eat the vegetables, what would help them make a change. Do we need a farmer's market? Do we need additional resources? Do we need resources to help with food insecurity specifically, so financial resources? And then reinforcing, how do we positively reinforce good behaviors and negatively reinforce behaviors that we don't want to see happen, right? How do we measure that? Next, we have to think about how we start using all this information to design a program. How do we increase positive enabling factors? How do we make sure there's some sort of reinforcement to keep people on the right path? Now, in this example, I'm focusing very much on a behavior, if you'll notice, and Pre-Seed Proceed is pretty behavioral focused. But quite often, folks are working and living and coping in environments that are difficult. And so it's not just an individual behavior. We have to think about, oh my goodness, you don't have resources for that. Or, oh my goodness, how are we going to equip communities who have school systems that don't offer that same level of education? What are we going to do? So it's not all about individual behavior. Some of this language we're using feels like it. So I do apologize for that, but this is the idea that we're going to intervene to offer something. Could be a social needs-based approach that's very individualized. Could be a social determinants of health approach that's a very general policy approach, maybe. Either way, phase 4, we design the intervention based on our understanding of what's going to help us make change in our community. Then with phase 5, we actually implement what we designed, and then we start evaluating. So with evaluating, there are process, impact, and outcome goals, right? So process goals tend to be, did we deliver enough trainings, right? Maybe we had cooking demos or trainings or dispersed, something to assist with healthy eating or something to assist with nutrition. How much work we did as part of our program is a process measure. It's the thing we did. It's a process. The impact is how many people attended the trainings and said they would change their behavior, engaged maybe. Or furthermore than that, thinking past the process of just how many trainings and how many people, it might be in the next 6 months, who says they're going to try to engage further in our program, who says they're going to participate in the farmer's market. And then outcome looks at long-term outcomes. So we are looking at 2 years from now, did we impact diabetes in our community? Did we impact healthy eating in our community? That is an outcome focus. And this can be really, really difficult to measure, right? And to gauge. All right. Another model that we use going past Pre-Seed Proceed is something called intervention mapping. And this helps us fill gaps by thinking about all the data that we're collecting in our assessments and putting it into 6 simple steps right here where we develop a model to approach it, a logic model that lists out all the issues, we visually map it, and then we think about program objectives and goals, how we're going to move forward. We design the program, we produce it, we implement it, we evaluate it. This feels like what I just talked about. Again, different terms, but this is called intervention mapping. Now, you might ask, why do I need pre-seed, proceed? Why do I need that model in front of me? Or why do I need the intervention mapping model in front of me? You need to choose an approach so that you have guidance and you don't forget to evaluate part of your program, or you don't write objectives that can't be evaluated. It's just a framework to help us be disciplined and intentional about the good work that we're doing. Now, there's a lot of other models out there. For example, there's the Healthy Communities program at CDC, and they use something called the Change Tool. That's another model, very similar process and idea. They gather data on strengths and assets in the community. They look at opportunities to create positive change with those strengths and assets, and they focus on a model based on commitment to the change, making sure the community is committed to the change up front, and then they assess, plan, implement, and evaluate. So that's an example. Another one is something called, I call it ACHI, but it's ACHI, the Association for Community Health Improvement. And they are a group that developed a toolkit with 9 steps. And you may say, man, Parks, what is happening here? We've got 9 steps with pre-seed, we've got 8 steps with pre-seed, proceed, we've got 6 steps with the mapping. And keep in mind, I'm gonna use that word map a lot. This is intervention mapping, which is different from what we'll talk about in a minute for a map planning process. So this is a 9-step pathway to conducting a community health assessment. And so if we look at this one, this is how we evaluate and implement change in a community, but they're just using different terms. If you listen to my other lecture on community health needs assessments, we covered all of these and every idea listed here, but in a different framework. So there's different folks using different frameworks, but they all tend to include same similar elements. And they're all important to kind of get that workflow in your brain. The idea of reflecting and strategizing about what your community needs, identifying people in your community to talk to, defining the community you're working with very closely, knowing who, where, what neighborhoods, what populations, collecting data, step 4. Step 5 is you prioritize from the data. What health issues are we going to focus on? In the other lecture, I talked about critical and urgent, right? Are these really important things that have to happen, and are they critical or important? Then we document and communicate results to the community and say, we're going to start addressing this, help us plan it. We plan it, we implement it, we evaluate it to see if it worked. Same idea again, right? Same kind of circle. And if you've done any work on the health services side or in public health with healthcare quality, we often implement change in healthcare systems using a very similar model that's a circle, rapid cycle improvement, where we define a problem, we measure the data, we analyze it, we implement an improvement, and then we evaluate or control, make sure it's stuck. Same idea here. All right, so there's a few other planning models. All of these, if you Google, have their own toolkits and resources, which is great. Things like MAP-IT. And we're going to talk a little bit about the MAP, M-A-P-P planning process in a minute at the end of today's lecture. But this is a model that's designed to help people specifically address goals that are part of Healthy People 2020 and now Healthy People 2030. So it's very specific for goals laid out by the federal government. Then we have SMART, and SMART is a social media approach. How do you make programs that are designed to work through social media and evaluate them? And then how do we do community-based marketing to promote healthy behaviors, prevent negative health outcomes? So these are other models. There's even more here. There's PATCH, which is the planned approach to community health. There's the health communication model. And then there's things that we use in management science all the time in healthcare, like a SWOT, where we look at whether or not our organization or our community has certain strengths, certain weaknesses, opportunities to grow, change, improve, and threats that could hurt our organization or limit our community's ability to do good things. Those are other models. I'm going to go through several examples at the end here, but these are just so you know there are so many options. So if you're curious and you're interested, connect with me. I'd love to talk through them. But also, these models exist, and there are lots of different approaches and things that you can learn as far as tools for implementing new programs. Okay, so when you're choosing a planning model, You have to think about the 3 F's of planning. How do I know which model to choose? You need fluidity. What steps in the planning processes work best with what you're dealing with? For example, the model I was just looking at, the ACHI model, this one focuses on who you're going to engage. The whole first 3 steps are just talking to your stakeholders, engaging them, reflecting. Whereas other models like Pre-Seed Proceed, step 1 is collect the data. Like you already know who your community is, you're going. So some of these models emphasize different pieces of the process more or less. And in this model, we emphasize that reflection and figuring out who the people are in your community who have a say, who are part of your target population, who can make a difference happen. That's the focus. And so you have to think about fluidity. What model allows you to do what you want to do in the right order of steps? How does it flow? Flexibility. What model is going to work with your stakeholders' needs and is adaptive enough? Don't use a model that has a 10-page tool that you have to fill out about your objectives if that's not what you want to do. Use a different model. So you have to do your reading and see what tools are used for each model and what fits what you want to do. Then there's functionality, right? Which model looks like it would bring about the best results? Pre-Seed Proceed is kind of the standard, like I said, in the generalized planning model. But the idea of using something that really helps prioritize and reinforce what you're working on. And also realizing that we're going to take a population-based approach for most projects. We're looking at helping a group, and we're keeping in mind the ecological framework, the policy landscape, organizations, right? Groups and communities and individuals, the idea that we can work at different levels in our community. Now, I'm going to show you an example of the MAP planning process in a second here. And this is one that I've used before. And the reason I've used it and really liked it, and I apologize, there's supposed to be a beautiful graphic here, my apologies. But the reason I've used it and really liked it is because MAP allows me, and I apologize, none of my graphics are showing up. Give me just a moment. My apologies for that brief intermission. For some reason, PowerPoint was having some issues. So as I was saying, this is the MAP planning process. And I'm sharing the specific example with you because MAP involves conducting 4 very specific types of assessment as you start planning. And so this is the right model if you need those 4 types of assessment. If you're looking at making change in the policy landscape, you need these approaches. So it looks at the strengths and needs of the community, community themes and strengths, look specifically at what's important to the community and what strengths they have, and developing a vision for the future. The local public health systems assessment on the side here looks at the community resources, what resources exist from a local public health perspective, healthcare organizations, aging organizations, community health, but also health services. So the whole spectrum, even educational access. It looks at everything keeping us healthy. And then we look at the community health status assessment, which we already talked about. Those are all the health issues, health concerns, where we're currently at with our health, which is different from the themes that are important to us and our strengths at the top. And then we have something called the forces of change assessment. And I'll give you a quick example of that just because I worked on one of those with a colleague of mine. It was very special. So forces of change assessment, when we did that, we were working on an air quality grant that I shared about before in the other lecture. And in that project, we actually went out and created a giant spreadsheet, hundreds of lines of data of every potential policy change that was coming. So forces of change is understanding what might change at the state, local, national policy level. Is there going to be a new law that changes the way hospitals function? Is there opportunity to work with different types of organizations? So you're thinking about the big movers and shakers, if you will, but also what potentially could impact your work that is changing from a political perspective. And we call that a forces of change assessment. So MAP involves conducting all 4 of these in order to organize your program plan. And you'll notice this cute graphic here. You want a healthier community. In order to get there, you perform those 4 assessments, and then you design a program, action cycle, and you plan it, you implement it, and you go. That's the MAP planning process. So MAP is the concept that no matter what we do, there's always going to be disease. And the idea of a healthy community isn't simply about being free from disease, but embracing community identity, right? Being positive and inclusive and well, not just free of disease, but promoting good values, right? And it's a community-based view of health. It incorporates environmental, social, psychological, and political health as well. This is a poster from, I think, 2010, 2011 APHA, years ago, that we shared, some colleagues and myself, that we shared at APHA. And basically our goal was to share the results of all 4 of our assessments for that air quality project. We met with community members, we assessed the resources in the community, we looked at different threats to community health, and we looked at goods movement, the idea of merchandise, products coming into Long Beach and Los Angeles ports and then being distributed, and how does that impact health? The trucks and tankers and all of that. So this is an example of that process. So MAP has to do with systems thinking broadly about your community's health, creating a dialogue in the community, conversation around a shared vision, looking at the data together, and partnering to be really strategic about planning the success of your community. So we call it a participatory process. And it's based on participation of all the local public health agencies, but also community members to conduct these 4 assessments. And so the reason we do this is we want to strengthen the local health system. We want to provide better services. We want to engage the community, but we also want them to own that process. We want it to be a celebration of the community's identity and creating that, making sure individuals who are part of that identity are healthy. So who should take part in that process is everybody. Local and state public health officials and agencies, health practitioners, first responders, community members, human service organizations, and politicians. Now, earlier I said you had to think about the 3 F's, right? Was it how flexible, fluid, right? If it's the right format, all of it for planning. When is MAP the right option? If you have current or potential health issues that you want to focus on, and everyone agrees that there's some issue, crisis, something that we haven't handled well in the past and that we need to rally around. If you know what you're targeting and you can conduct these 4 assessments based around that health topic. In our case, the example I gave you was it was air quality related health indicators, including cardiovascular disease, low infant birth weight, and asthma. And so we were able to get the community rallied around that. And it's also a really good idea to do anytime there's big change. If we're building a new health facility or re-examining our system and making changes, MAP is a great way to do that. So we organize for success at the beginning. We vision, we conduct visioning, we think together strategically. We do the 4 assessments. We look at strategic issues and distill down what we want to focus on to develop community goals, to then plan, implement, and evaluate a project. Now, the next few slides are just that step by step. So we organize the community, we design the planning process together, and engage as many people as we can in doing it the right way. Once we have everybody engaged, then we start visioning. We talk with folks about a strategic process and say, what is our vision for our community? Who are we and what do we want to be? And what do we value? What are the themes that are important? And then we start assessing. And this could be a 6-month, a 1-year, a 2-year, a 3-year process of looking at the strengths and key themes in our community, who we are, what we have to leverage, what we can do, looking at the strengths in specifically the health system itself. And then we do the community health status assessment where we look at employment and housing and the environment and different disease rates, all the epidemiological information, and then examine what could happen in the future. What are the threats or opportunities in the policy landscape? That giant spreadsheet that Portia and I put together of all the potential laws and changes that are coming. That's a forces of change assessment. So these slides walk through key questions and information that we gather at each level, right? So for example, with community themes and strengths, we try to understand the assets in the community. What is there? What do we have to work with? What is our quality of life? For the local public health systems assessment, we look at how we're performing each of the 10 essential public health services. Are we linking people to care? Are we mobilizing community partnerships? We assess each of these areas to see where our weak spots are. And then, of course, we look at the health of the population. And these are just a few examples, but things like social and mental health, maternal and child health, infectious diseases. And then, of course, we look at trends in the world around us, what is changing, including upcoming policies and laws and ideas, political changes, and what do we do to prepare for that? Once we're done with those assessments, we focus on strategic issues. What do we as a community want to do? What do we care about? What's our vision, and what did each of these assessments tell us? What are our goals and strategies now, informed based on all those assessments? What are we going to do next? And how are we going to implement it? And then we start that whole action cycle. So with the action cycle, it's very similar to pre-seed proceed in the generalized model. We plan, we do something, implement, evaluate. And there's a lot of detailed documentation around how to do that, right? But it's the idea that we start the planning now after we've already collected so much data and engaged so many communities around making sure we understand who they are and what they want to accomplish. All right. So I've got a couple slides left over here that I'm just going to go through quickly as a little reminder and a little thought for you. When I start out with a new process, when I want to do anything, I often do something called the 5 whys. And so when you're looking at health issues in a community and you want to identify what the health issues are and figure out the root cause, there's a method called the 5 whys to figuring out why so many people have diabetes. And sometimes it's not one reason, but to help us figure it out. So this is a quick example of a 5 whys. You take a problem and you ask why 5 times to get to a solution. The problem is I got a speeding ticket. Why'd you get a speeding ticket, Dr. Parks? I was late for work. Why was I late for work? I woke up late. Why did I wake up late? My alarm didn't work. Why? My phone was dead. Why? I forgot to charge it. If I had charged my phone before I went to bed, I would not have gotten a speeding ticket. Would that have been the obvious answer for you if I would have just said, why'd you get a speeding ticket? Oh, I forgot to charge my phone. So the solution to not getting speeding tickets, isn't that interesting how we go from one issue all the way to something else, but it's a cascading effect. So from a health planning perspective, we've got a lot of that going on. So this is public health as an iceberg, and I often think about it that way. We're trying to address the problem. We have to understand the root cause underneath. So here's 3 different examples. We've got high readmission rates in the hospital because of poor medication adherence. People aren't taking their medication. And that sounds very like pejorative and elitist. People didn't take their medication. No, they didn't have the health literacy required to understand the materials you gave them to take their medication. They didn't know and understand when to take what. Maybe there was a linguistic challenge. Lung cancer. My dad, I think I've shared with a lot of students, passed away from lung cancer on hospice in my home. It was terrible. He smoked. He worked a very hard manual labor job, never got to go to college, never had a lot of resources. So addressing some of those factors can help us limit negative health behaviors, right? So when you look at what these causes could be underneath, for example, obesity and heart disease, if we didn't live in a food desert, maybe that would be easier to address. So you can see these outcomes that we're addressing are really fueled by things that we may not even think are the root cause. So I use a tool called the fishbone diagram to map this out. So you can use the 5 whys and just ask why and why over and over again when you're doing a needs assessment or trying to figure out a health problem. But instead, you can use this process, and this was developed as part of Toyota's methodology in Japan years and years ago as part of Lean Six Sigma thinking. But the goal is to design a diagram that helps you understand all the root causes, or a root cause, potential root causes for a problem. This is a visual of that. We write the effect or the problem, the thing we're trying to solve, at the front, at the head of the fish. And then we design little bones, little structures. And we can use different labels for those structures, but quite often we use something called the 4 Ps. Procedures that could lead to a problem, policies that could lead to a problem, place issues that could lead to a problem, and people or behavioral issues that could lead to a problem. And this is an example of how that can look. It doesn't have any data in it yet, but we've got procedures, policies, places, people, problem. And again, these are the definitions. Procedures are available materials, processes, structural elements. Policies are all the laws and norms that are in place. Place and technology could be anything around you, social media, and then people interactions. And so here's an example. This is an example looking at SIDS rates. So in this example, there was an elevated rate of sudden infant death syndrome, or SIDS, in a certain county. And so they mapped out everything they thought could contribute. Things like communication methods were outdated, so nobody was talking to the families. No social media outreach to let them know that this is a risk and how to, make sure they lay their baby in a certain way and watch them in a certain way. None of that education was available in this county. So these are all potential factors. We list them out, and then we go in and circle or put arrows next to the factors that we're pretty sure are issues. Things like lack of safe sleep education. Why wouldn't every hospital have a pamphlet on this if babies are actually dying? Right? What about the fact that Twitter, Instagram, Facebook are blocked at the health department, so the health department can't use social media marketing to reach out to families? They can't post tips to avoid SIDS because they're not allowed to use social media at work, even though it's a valuable public health tool. This is a fishbone diagram. So going back to the assessment piece, I love to use this tool when somebody comes to me with a problem. Is that really the problem? If it is the problem, what's the root cause? We start to use these tools to dig a little deeper. So thank you for joining me today. I think in summary, we've got a lot of different models to choose from with public health program planning. The generalized model walks us through assessing needs all the way through evaluating results. And then we have these other models, right, that we talked about briefly. These are kind of the top 5 that I see and normally leverage. All of them are highly Googleable. You look, there's toolkits, there's resources online, CDC, tons of information out there. And of course, I'd be glad to talk through if you have specific questions about any of the models. All right, thank you so much. I greatly appreciate you listening to this little overview. I hope it was helpful and educational. Have a great day.